I was thinking today, doctor, about what every pediatric dentist needs to know and what every general dentist who treats children needs to know. And it's going to be a little bit different for each group. Usually, I'm teaching you the same things, but listen to this. In pediatric dentistry residencies, you learn that you are the purveyor of the special needs child patient, and even of the adult special needs patient. And you general dentists have learned that that's when you refer, which is fine, to the specialist. That's why we have specialists. However, I really want to question this concept that the pediatric dentist should have these patients relegated to their care on a regular general basis. Are you the right person? I think you need to consider that. First of all, if you are, whether you're a pediatric dentist or general dentist, if you are interested in treating special needs patients, let me give you something to think about. Number one, if you spend a good deal of your restorative time in the operating room and you figure they kind of fit the pattern because you can take them to the OR, yes, that's one way to look at it. And certainly many of those adult special needs patients should go to the operating room under general because it's really difficult, if not impossible, to do a great job for them in the clinical setting, and for some children too. However, I think that our automatic jump to general anesthesia is a question that we should ask ourselves for the special needs patients. When will the special needs child get to be a compliant and easygoing and good, if you will, pediatric dental patient and ultimately adult dental patient? You see, when will they learn? When will they learn anything about coping with what's going on in their life, about living as normally as possible? Do you know that if you look at it this way, that you can add to that child's ability to learn to be a, quote, normal dental patient, to learn to be someone who functions with stress, someone who copes with difficulties, then you're going to offer them something that most people in their lives don't offer. All of the experts are telling the parents their child is special. They should treat them such. All of the experts are telling, and almost without fail, when I say all, I mean 99%. I guess nothing's 100%. They're telling the parents, take it easy on them. Don't push them too much. Really? I want to tell you a little story. My now 28-year-old son was diagnosed at 2 as autistic. He now has a degree from a university in Texas, and he has a bachelor's degree, and he graduated cum laude. Now, this was a child who at age 15, I started working with him on how to read. I started giving him the right level of discipline, meaning understanding the consequences for his behaviors. I started giving him my expectations. We both did. Claude and I both did, of what we expected of him. And by the way, I started giving him consistency as we did all of these things for all 3 children. Don't treat them differently. Treat them normally. But give any of your children the level of expectation, the discipline and ability to set limits that you can do, and the consistency that they need. Do this with your child patients as well, special needs or not. You see, you can change their lives for the better. You can be a model for the parent. And the parents in my practice where I do treat some special needs children, both in pediatric dentistry somewhat, little by little these days, and mostly in orthodontics, they love me for doing that. And when I insist that the child is going to have to sit, or the child is going to have to open, or the child's going to have to whatever, and I insist by doing it for them, they can have a cuddle coat, papoose. Of course, parents sign, they understand, so forth. They can have a molt mouth prop so that their mouths are open, so I can be safe, they can be safe, and we can work. Whatever it is, we're giving them the discipline, the expectancy, and the consistency to make it work. So you who have been trained that it should be relegated to you, Decide if you want to do that. Understand it's going to take more time. Understand your fees should be higher, doctor. If it takes more time, they should be higher. Make it work for you and for the parent, because there aren't too many people out there who are going to treat these children very much. What they're going to do is they're going to be sweet with them, they're going to smile, they're going to give them a hug, they're going to watch the child jump out of the chair and stand over there in the corner. If you want to treat a special needs child, you don't do it because you've been told in your residency that you should. You could be a general dentist, you can be a pediatric dentist who likes to treat children and is willing to try and work with these children and parents. You are certainly able to do that, but don't feel that you must, okay? And you general dentists, if it's something you can do, don't refer. If it's something you choose not to do, refer. That's the beauty of general dentistry. You refer the things that you don't enjoy and you keep the things that you do. And the same holds true for you pediatric dentists. Don't treat a child that you don't enjoy. Explain to the parent that you don't have a match, that you don't think you can serve them like you would like to, and they're going to have to find someone else, and you may help them do that. So this is something that every one of you who treats children should know. Little bit different take for the pediatric dentist who's listened to their residency people tell them they should do this. There are no shoulds in practice. When you get shoulds, you can't keep your passion and your joy in doing what you do. Some thoughts for you today on special needs patients. Dr. Chris, signing off.